A very good evening to all attendees. I am Arpita from the IGCP group, and I warmly welcome you all to today's insightful webinar on the topic from nose to eyes. Just a minute, sir. A very good evening to our attendees. I am Arpita from the IGCP group, and I warmly welcome you all to today's insightful webinar on the topic from nose to eyes: managing allergy as a progressive disease and unmasking underdiagnosed ocular allergy. We are privileged to have with us two distinguished experts, none other than Dr. Vijay Varatsa and Dr. Vishali Varadnam. She will be also joining us shortly. To introduce her, he is MBBS, MD, a renowned consultant allergist, pediatric pulmonologist, and clinical immunologist. He is affiliated with prominent healthcare institutions, including Sai Allergy Asthma Eye Hospital, Shadri Hospital, Multispecialty Hospital, and the Pune Allergy Center. He will serve as the speaker moderator for today's session. And yes, we'll be joining Dr. Vishali Varad ma'am. Ma'am is MBBS, DNB, DOMS, a respected clinical investigator and senior consultant at the Sai Allergy Center, Pune. Her extensive experience in ocular allergies and clinical research adds immense value to today's discussion. We look forward to an engaging and enriching session. So, without doing any further delay, sir, I would request you to please start with the topic for today. Over to you, sir.
Thank you, IGCP, for giving the opportunity, and thanks to Arpita for introducing. So I'm just sharing the screen. Sorry for the delay. I mean, because of the rush and some emergencies. So now, if you see the current scenario, and the allergies are increasing, and this was like a now there is a World Allergy Week going on. So we thought like we should talk on management of allergy from head to toe, I will say, and to rhinoconjunctivitis also, which is very important. And why the allergic diseases are increasing in India. So we are using so much pesticide into the urban areas. The traffic is there. Then smoking habits of the people. Then burning the tobacco, burning the bio waste, still into the slums and into the rural areas. Then because of the insects and all, a lot of people use the mosquitoes, coils, the deodorants, perfumes into the temples and at house also so many agarbatti, dhoop they have used. They are again as a allergens, and they will go on increasing the potency of the allergens. So even if you see the European Journal and the multi-center population study, Indian study on asthma, respiratory, and chronic bronchitis. The study was conducted in 12 centers in the rural and urban areas, and they predicted 20 to 30% of the population suffering allergic rhinitis. We did a study, and I was one of the principal investigators who were publishing in Pulmonology Journal. 50% of the population is now suffering from allergic rhinitis. So we thought like we should why it happens ki like one fine day the person was exposed to the same dust mites or same animal landers or pigeon feathers or the humans. Now he starts showing a trigger because initially the sensitization happens, and then when it reaches to that threshold, then the triggers will start. So if you see, even the chronic respiratory diseases is the second death causing disease. So this early phase, the sensitization because of the dust mites, pollens, animal dander, insects, molds, feathers, or foods from the skin dendritic cells. The release of these inflammatory mediators, they go through the blood to the organs, and then the organ-specific inflammation happens. And in the late phase, the re-exposure will cause the inflammatory mediators release, and then the causing a nasal blockage or sinusitis or rhinoconjunctivitis. The nose mucosa, which is connected to the eyes, to the ears, to the sinuses, to the airways, and the inflammation into the body leads to the even skin problems or gut inflammation, gut allergies, food allergies. So the indoor-outdoor pollutants, and when it leads to the multiple inflammations, even to the 19, the allergy epidemic has been declared. And from neonatal allergy, from food allergy to medication allergies to anaphylaxis because of the vaccines or some medications, and then IG mediated, non-IG mediated, and mixed reactions are common. So the gut inflammation, the swallowed allergens like pollens and dust mites, they go to the gut mast cell eosinophil sensitivity, leading to the bloating, indigestion, food intolerance to the actual food allergy, leading to the within 2 to 3 hours showing a very severe reactions. So the percentage wise, it is increasing only genetic, like hereditary part, maternal factors, parental environmental exposures, and then the dysregulation of this immune system, TH2 to TH1 or TH1 to TH2 inflammation leading to that. And this TH2 polarization and the effector response leading to the symptoms of the body. So from skin to gastrointestinal to respiratory to the systemic. So even now we are seeing a lot of anaphylaxis cases recently. Then this gut microbiome immune dysregulation will cause a dysbiosis. That's why now probiotics have a very good important role. So as a practitioners, we should keep into the mind that this preventing allergic march leading to this rhinosinusitis, conjunctivitis, asthma, chronic respiratory disease should be kept under the mind. So what happens with the childhood asthma patients? 80 to 85% they overcome the asthma, but many of them go into adolescent eczema, allergic conjunctivitis, VKCs, ear problems, 30% deafness is because of that. This minimal persistent inflammation should be managed while managing these patients. So even we publish the article into that, how the atopic march which leads to the asthma, rhinosinusitis, obstructive sleep apnea, snoring, vernal keratoconjunctivitis. And it has a lot of burden to the community. The early phase, if you manage with the proper allergy testing and avoidance measures and all, we can stop this progress of the disease. We can reduce the oral and parenteral steroid dependent antibiotics. We can reduce the anti-allergics also. Even working with the World Allergy Organization Allergy Prevention Committee, myself and Dr. Ushali were involved into that. How to prevent these severe food allergies and atopic dermatitis because that is a early part of the allergic march. So many children also present with the gastrointestinal symptoms, infantile colics, and they are missed. They are just treated symptomatically, and then they lead to the further complications. So this was a child which has a initially JRD like vomiting and all, then skin involved was there, then the respiratory throat and all. It was treated, but now periocular eczema and severe vernal keratoconjunctivitis, even the early age cataract because of the repeated eye steroids. So even the oral and parenteral steroids and repeated eye steroids can cause such type of complications. So if you see the commonly, most of the patients nowadays post COVID are showing these skin symptoms affecting very badly, and the common allergens, as already I discussed about the indoor molds, outdoor molds, then this retching, boils, pimples, the itch is so severe that it affects the quality of life of these patients. Even it is worse than the asthma, diabetes, epilepsy. And then because of the nighttime difficulties sleeping, then the first generation antihistaminic causing a sedation, sleep cycle effect, and then there's an imbalance of the gut microbiota. As I mentioned, these are swallowed, they cause a gut inflammation, then the leaky gut happens, then the additives, preservatives into the foods, biryanis, so many outlets, then frying, additives like sulfites, coloring agents in the ice cream and all, they will cause a significant skin involvement as well as severe food allergies. So even nowadays, outside everywhere they mention in the menu also, suppose somebody has a food allergy, inform us. Then this cross reactivity of the foods causing a oral food allergy syndrome. So suppose grass pollen cross reactivity to the citrus fruits and all. Then birch pollen to the apple. Then prawns has a cross reactivity with the dust mite, derpy1. So these cross reactivities cause a gut inflammation food. So practically managing these patients, we have to manage the gut microbiome also. So the gut brain, gut lung, gut skin axis should be kept into the mind. So while managing this, the regulation of the immune system, the dysbiosis should be considered, and then the specific leaky gut should be controlled with the zinc, vitamin D3, probiotics, preventing the outside food and colors, And so even the from seborrheic dermatitis to hair loss to skin conditions to the systemic symptoms. So it's already a third leading cause amongst all ages. First, chronic disease in the children like asthma. Then these pollens, insects, animal dander can travel around 15 to 16 kilometers. Dust mites into the bed daily we say around 1.5 gram of skin. 1 gram of skin, more than 10 lakh dust mites can survive. Then molds, we did a studies into the kitchen food particles along with the vegetable fruits. On people go to the outside into the garden and all they carry on the spores on their hairs and clothes. And these dust mites are very significant. Like
The feature class, and
so
since
they are
the most
corrodes into the
migrants
bed, sofas, curtains, cushions. Then these pollens, we are doing a studies, we are collecting the
अच्छा
pollen,
खाली ते
we
सगळं
are analyzing
हे
that,
मशीन
how it
अच्छा
can be
खाली
helpful
ते
so that
सगळं
the cost also therapy can be reduced. So even the cancer is not a big killer. The asthma COPD overlap syndrome, which is leading to the complications. So rhinitis is a central part, and then the skin, gut, eyes, diverticular septum, tonsil, throat infections. Now, last 4 days, we are seeing a lot of upper airway cough. Then the hearing, the laryngitis, GRD, they are all connected. So, like this child had a eczema, repeated steroids, discoloration, this like upper carious teeth, halitosis, foul smell, these dark circles, the denim organ folds, they are very common into these patients. Such type of things like even the process, the papillary, then mouth ulcers, you can see the terminate hypertrophy, eye allergies. These are very common. This was a child with a adolescent with a angioedema with anaphylaxis. Tonsil adenoid is very common. Surgeries are not required. Proper management. Very few patients with the pulmonary hypertension or obstructive sleep apnea having a difficulty like a gasping. Then only. Then this secondary drug eruptions and the food allergies are also very common. Then urticaria has increased only. Then some of the patients, the trigger can be because of the allergens, like adolescents with the angioedemas and sinusitis. The same patient with the infantile secondary eczema. So the dark circles, venous to the wrinkles, denim organ fold, bullous muscle spasm, watering of eyes, open mouth breathing, this facial like rubbing, then just lift the tip and see the terminates. This rubbing because of that, the fold happening over there, doing this way, posterior pharyngeal cobblestone appearance like. So these are nutshell the signs. So you always look for the lymphadenopathy, skin dryness. 70% of the patients have that, and then upper airway TH2 inflammation, having a secondary infections, tonsil, adenoids, throat problems, this clearing like things are very common. So the involvement has increased now, and most of the patients they get first here, and then they lead to the other parts of the body. So now TH2 inflammation should be treated properly rather than just treating the different organs. So the snoring, open mouth, halitosis, bedwetting, restless sleep, waking frequently, difficult to sleep, so prone position, hot potato squeeze, frequent colds. So depending on the genetic, hereditary, lifestyle, microbial diseases, allergen exposure, the patient have a different type of symptoms. Open mouth breathing, snoring, repeated. Some patients have a whitening over their pustules, hard, like this way. So eosinophilic inflammation is very common in upper airway cough syndrome with the chronic rhinosinusitis, tonsillitis, and then some of the patients have a recurrent throat problems, persistent cough, postnasal dribbling, then secondary complications leading to the streptococcal infections like rheumatic fever, glomerulonephritis, facial changes, ear problems. Allergy testing, some of the patients, if required only CT scan or something, the exposure of the radiation is a problem. Then cytokine profiling also can be done. Anterior rhinoscopy is very important. So these patients, according to the history, properly examine them, hidden signs, ears, retros drums or something. Then while managing the safe antihistaminic should be there. Second generations. Then Montelukast There add-on therapy for the difficult cases. Very few patients require oral antibiotics and steroids, but they are overused. In long-term wise, the allergen immunotherapy and biologics are the targeted one. Like biomarkers can be analyzed and we can use a specific targeted against the interleukins or Th2 inflammation. Very few patients with a significant pulmonary hypertension with obstructive sleep apnea. After the sleep study only, we should go for the surgeries. Along with the symptomatic management, the environmental awareness, lifestyle changes are also very important. Cytokine inhibitors, microbiome modulating gene therapies are the future therapies. So while understanding the Th2 inflammation, which continues to the systemic part of the body, leading to the gut brain, gut lung, gut skin axis to skin problems, to the GIT, and potential risk to the chronic respiratory diseases. So the inflammation management underlying by the proper balanced diet with the sunlight exposure, forefront awareness, comorbid conditions treatment is very important for the long term. So actually, this part was supposed to be covered by the Dr. Vishali, but sorry, her aunt had a surgery today and she had been to Mumbai. She's on the way and we are trying to reach her, but maybe on the expressway there is a internet connection problem. So I will also cover up this. As we are practicing both together, we have seen a lot of rhinopharyngitis cases increasing. It is most neglected, underestimated, underdiagnosed. The rubbing of eyes is an early sign in most of the patients. And then in between the patient is fine. Then they go into severe vernal keratoconjunctivitis, severe allergies, perennial allergies, and then Shield's ulcer, then limbal cell deficiencies, blepharitis, external stye, as well as because of the rubbing, keratitis can be there, secondary infections. So even last year, severe conjunctivitis epidemic was there. Among that, underlying inflammation to the eyes is very common. Even the nasal steroids, then repeated nebulization, inhaled steroids for long, the combined effects of that causes a significant dryness of the eyes and leads to the again secondary problems. So the same way, some of the patients, if they require a repeated eye steroids or repeated immunosuppressants into the eyes also, they may cause early age cataract glaucoma as a complication of the drug therapies. So these patients like same these biologics like omalizumab, dupilumab should be used. Then this was another case with a 14 years old with a severe growth retardation barrel shaped HRCT was done. But with the proper testing, like dust mite processes and molds, improvement was seen within 9 months. Then 12 years old child with failure to thrive. So many of the patients, the build and the height also can be affected. You can see these long eyelashes and wrinkling and protruded jaw and turbinate hypertrophy. So then the eczema and rhinoconjunctivitis have a similar type 1 and type 4 sensitivity. Like when you see the long eyelashes of this patient. And within dust mite desensitization and milk allergy avoidance measures in this child had a very good recovery within 9 months. Then this was a patient referred from a corporate hospital with the post hypoxia, repeated LRTI and all. He had a dust mites contaminated with the peanut butter. So this is very common like papillae and keratitis in many of these 20 to 20, 35 years old people. So while managing these patients with the rhinitis, rhinoconjunctivitis and all, the external exposure avoidance, then the specific targeted second generation antihistaminics, montelukast, then biologics in specific cases and immunotherapy, which will stop the progress to the rhinosinusitis, ear problems, deafness, obstructive sleep apnea, then chronic respiratory disease leading to the one mucosa, one disease. The safer is second generation antihistaminic, loratadine, avastin, elastin, fexofenadine. They are very useful in these patients. Montelukast as an add-on drug in a stage 3 rhinitis or asthma with rhinitis or exercise-induced asthma patients, which is useful. They are a nicotine receptor antagonist against the IL-D4, E4. Then, depending on the progress of the disease, the food allergy reduces, but later on the yellow allergens increase and multiple sensitivities, inflammation, and it reaches to the that threshold where the overflow of symptoms happen, leading to the complications in these patients. So, even 80 to 90% of the patients show the allergic rhinitis or comorbid allergy. And triggers also in the skin allergies can be identified like this dust mites, pollens, and danders. Primary, secondary, tertiary prevention should be achieved with the breastfeeding, early introduction of the foods like nuts or butter, peanut butter or milk. Very few patients where there is a significant anaphylaxis symptoms, avoid it. Then with the leaf studies, the desensitization against the food allergies also can be achieved. Exclusive breastfeeding is very important. And these dust mites and pollens can stop the complications and improvement of the barrier repair with the proper moisturization, with the avoidance measures. And immunotherapy as a disease modifying therapy can. Then probiotics are very good. With the research one, they will have action against the cytokine, toll-like receptors and proteoglycan. You can see they reduce the infections, they reduce the inflammatory mediators and improvement into the TH1. So now these IG mediated diseases against the respiratory allergy management to restore this TH to TH1 microbiome are playing a very important role into the most of the allergic diseases from sinusitis to ocular allergies to throat infections to the rhinitis, conjunctivitis, asthma, gut allergies, gut inflammation, eczemas. They have shown a very good efficacy. And even in the third trimester, if the mother are supplemented properly, the babies, the late phase or the delayed allergies will be seen or severity also can be reduced. In gut lung axis, the respiratory microbiome have shown already a very good efficacy. Even this, as I mentioned, the reduction into the IgE and the specific probiotics which get absorbed to the pH patches, the lymph nodes to the, they activate the dendritic cells. So suppress the production of the IgE and promote the TH1 cytokines so that the secondary infections. So there has to be a proper release into the uh, targeted organs. So the specific probiotics should be used rather than so many advertised ones. So there are few like studies done all over India. In our organization, we did atopic dermatitis and respiratory probiotic, uh, and we have found a very good results into that. So anti-allergy probiotic have significant improvement rather than the oral and parenteral steroids. And exposure to the palm dust, cow dung, natural infections. And immunotherapy has been very much in 2025 they accepted subcutaneous sublingual immunotherapy, specifically for the dust mites. Subcutaneous is used many years, but sublingual is increased now. Even tablet form immunotherapy has been allergy testing in the specific cases to avoid the specific allergens. So even you can see 85% of the patients show very good results. After the skin prick test, allergen avoidance and immunotherapy, so many advertises are done. The blood tests are not much useful except the component result diagnosis in case of significant food allergy like anaphylaxis. Even a very small amount each and every time within 2 to 3 hours the patient has to respond. Otherwise, most of the time the cross reactivity or food intolerance can be there. So the skin prick test they measure the bound mast cell IgE. So the sensitivity and specificity also 1 millimeter tip, pinless, bloodless. And if there is anaphylaxis, then different epitopes of the proteins or the latex sensitivity or honeybee. Like recently, one of the producer after the swallowing of the honeybee, also he had anaphylaxis. So we can. So in Pune, we did an analysis like dust mite, pollen, molds, and pigeon feather. They are the primary one. So avoidance measures are very important specifically. Then the dust mite coat covers, the mask use during the smog and all. The pets should be kept outside, not on the beds and sofas. Then 5% liquid ammonia on the boards. Then, besides the safe antihistaminics and nasal sprays, inhaler therapy in asthma, immunotherapy will have a specific IgG1 antibodies against the specific IgE and the mucosal IgA improvement to the tissue inflammatory rate, improving the quality of life and the these inflammatory mediators like interleukins. The targeted therapies is this rhinitis, asthma, rhinoconjunctivitis, skin allergies, food allergies will definitely improve the symptoms, early onset efficacy, long-term benefits, prevention of newer sensitivities, prevention of chronic respiratory disease, cost effective in long-term wise. These IG-mediated diseases can be used the immunotherapy and for a proper one. So reducing the Th2 to Th1. So even World Health Organization has accepted the allergen immunotherapy. So biomarkers like these Th2 interleukins into the allergic rhinoconjunctivitis. Dr. Vishali has done a lot of studies into that, and even these chemokine and cytokine levels into the Ts. So that's targeted omalizumab, mepolizumab, benralizumab, dupilumab, tezepelumab, anti-TSLP will be the future into therapies. Long-term wise symptom control and long-term complication avoidance and the cost also reduced with the proper allergy management. Considering the global warming and increasing the potency of the pollens and all, we need a better management in allergic diseases with the proper avoidance measures, the identification of specific targeted therapies, and long-term benefit to the patients and stop the progress not only to that patient, as the most of the adult allergies have a beginning in the childhood. Even the next generation also to reduce the uh, complications, the allergy management is very important, like how we manage the diabetes, blood pressure, or psychiatric diseases and all. The same way, allergy management will reduce the hypersensitivity to the normal sensitivity. So most important is it is not a lower immunity, it is a specific uh, therapy, and that awareness is required in India. And combining together, I will request all the practitioners and the community also that how we look towards the disease, hit hard and hit fast. Once allergy is always allergy till we don't manage it properly. And we can definitely help with the simple measurements like not to dust, use a wet mopping, use a vacuum cleaner into the car, into the deep office of kitchen, to the sofa, curtains, cushions, into the and use a mask during the winter. Have a good lifestyle, not to have so many color things and ice creams and junk food should be avoided. Healthy, nutritious, organic foods. So much pesticides used, they are having a gut inflammation and complications. So combine efforts from political level to the government bodies to the NGOs to the private public partnership with the doctors. It will definitely help to the community. Thank you. Thanks a lot.
Thank you, sir. Thank you so much for the insightful talk. Now, with your permission, I would like to take the questions from audience.
Yes, please.
Sir, are there any recent advances or preferred treatment strategies in managing the ocular allergies in pediatric patients specifically?
Yes, I mean, as I mentioned, the nasal steroids also help to stop the nasoocular reflex. The safe eye steroids under the slit lamp attached cameras, it should be monitored so that to prevent it. And the oral montelukast with hexaphenidaine elastin, and then the targeted biologics, and the desensitization as immunotherapy definitely helps a lot.
Okay. Sir, what are the red flags that suggest nasal allergies are progressing to involve the eyes, and how should clinicians intervene at that stage?
Most important is that rubbing of eyes is very important. Once it starts, that means ki there is a ocular allergy has started. Watering of eyes, discharge, frequent blinking, irritation, congested red eyes. These are very important. Blockers nose, open mouth breathing. They will have more, and people doing this way, sniffing inside forcefully, will cause again more problem.
Right, sir. Thank you so much. Two more questions are there.
Yes, please.
Sir, what role does allergen immunotherapy play in controlling both nasal and ocular allergy symptoms, and at what point should it be considered?
Actually, allergen immunotherapy, there is a significant family history of severe allergies. And if the child is having a significant hidden signs of allergy and more progress of the disease, in moderate to severe patients, immediately we should start allergen immunotherapy. Not only the rhinoconjunctivitis, it helps for asthma, sinusitis, ear problems, everything that way.
Right, sir. So there is one last question. That
Yes,
is,
please.
how often do you see patients with allergic rhinitis who also have undiagnosed ocular allergy symptoms? And is it a common overlap, sir, in your clinical practice?
Actually, it's a very common overlap. In 2018, the World Allergy Organization has said 95% of the children with rhinitis have ocular allergy, it is hidden. 60% of them have very severe symptoms later on, with the rubbing, watering, discharge, reddening, papillae formations, and many of them, 30% are underdiagnosed, undertreated, leading to the severe keratitis, field ulcer, overuse steroids, causing early age cataract, glaucoma, even requiring corneal transplant, lesser treatments for keratoconus. So they are very common nowadays.
Audience, if you have any other queries, kindly post it, or else I would conclude the session for today. So let me check once, and if there are no more queries, then I will conclude it.
Okay, sure.
Sir, there are no more queries, so I would like to conclude. But sir, before that, on behalf of the entire team, I would like to thank you, sir, for your heart, for your very insightful and very progressive nature of approach that you have showed on allergy. And sir, thank you so much for shedding light on this important topic and helping us to understand this topic in a better way. So once again, sir, I truly appreciate your time and your contribution towards this webinar. Thank you so much, sir. And
Thank you.
thanks to all our audience for joining in for their questions and making it an engaging one. So, sir, I would like to conclude our session here. Thank you so much, sir.